Thank you very much. For our next exercise, each one of the groups has come up with a statement or a question that we would like to have some kind of assessment of how all of the forum members feel about it. They haven't had a chance to talk about all issues, and also some people speak more than others in these public settings, and so we would really like to be able to get a sense where everybody is in terms of a few questions. So we'll start with the first question from the first group. Clicker questions. Are they up there? Okay. Group 1, accountability and leadership. You are the surgeon in the OR, and there is an unexpected negative surgical outcome. In this situation, you are always solely responsible, never solely responsible, share responsibility with your team, none of the above. Everybody voted? Registered your response, I should say. This is not voting, remember? Okay. 5% for always solely responsible, shared 3%, 25% shared responsibility with your team, and 30% none of the above. Okay? How about for the next question? Because these two are hooked together, and then we'll have some comments from the group. Okay. There's a slightly different outcome here. You are the surgeon in the OR, and there's an unexpected negative anesthetic outcome. In this situation, you are always solely responsible, never solely responsible, you share responsibility with your team, or none of the above. All right? Finish? Share responsibility again. Not always solely responsible. 8% though saying none of the above. I'm kind of curious who said none of the above and what other alternative would you have in this situation, and then we'll hear from Kathy if there are any other comments that might be relevant to this from the group. Here's a, it's okay.
Hi, everybody. Good morning. I'm Christine Zambricki, and I'm a nurse anesthetist. And I probably would have been one of those people if I had a clicker to say none of the above, because my answer would have been it depends on the circumstances.
It always depends, doesn't it? Yes, right, right. Context. Kathy, do you want to say anything about your group on that?
We really struggled with this case, and like we heard from some of the other groups, we kind of wish that we could have rewritten it before we had our discussion. But it's really interesting to see so many people talking about shared responsibility, because I think the sense in the room was that we wanted to make a declarative statement about that, but we were uncomfortable doing that because we recognized that situations vary tremendously, and you had to take into account the individual circumstances, and it might not always be the case where you could collectively share responsibility, and what would it take to make the systems differently such that they could be.
And I think it's interesting that the modal response in this group anyway is shared responsibility on both of those. Yeah. Okay, the next question from the next group. Oh, I'm sorry.
This is Leanna Orsolini. Just my mother it's my mother again. By the way, one of her stories of overtreatment is getting published in the Annals of Internal Medicine. So I'm really proud of her for turning down 4 unnecessary surgeries. Remember, I said yesterday she's had multiple sclerosis since she was 30. So she is going into the OR. This is a real true story. This is a different story than what's in Annals or what's going to be. She has to have her second breast removed, second primary breast cancer. And just the week before, the anesthesiologist had done some error, history of substance abuse, and killed my real estate agent, or the mistake killed the real estate agent. Where was the nurse in, and I don't mean nurse anesthetist, but where was the nurse in checking the O2 sat and the pulse and the reflexes, and where was the doctor? And as a patient family member, I would be so angry and hold everybody in that room responsible. You know, I mean, to me, that's so basic from a family perspective. So, and I know I'm very passionate about this because, you know, I was so worried that there wasn't enough teamwork and someone I knew died. And so there's just too much at stake to hold one person responsible.
It's a
And
collective
so-
responsibility. Okay. The next question for the next group. What infrastructural elements will the ACA provide for implementation of effective transdisciplinary professionalism? 1, economic infrastructure only, physical infrastructure only, social infrastructure only, all of the above, some combination of the above, none of the above. Okay. Everybody got their response? Okay. Some combination of the above seems to be the modal response by close to half. Okay. Would you like to make any comments about how your group saw that, or?
So we were wondering if the patient-centered medical home might be a way to sort of start to put the patient at the center. But we also, you know, we weren't really sure if that would be the same kind of concept that, I mean, we weren't really sure if that was going to be what we would want it to be. So I think, you know, that's sort of what we were thinking about with this question. But I kind of would like to hear, so it looks like there were no votes for physical or social. But then there were a lot of votes for some. So I'm wondering, for people who said some, what combination were they thinking about? Because I'd love to hear more about examples that popped into your minds.
I didn't put physical because I don't know that they're going to get into how things are structured, but I did have emotional, economic and social.
Okay.
Okay. We'll have to move along. The next question, please. Engaging the public as fully vested parties in a social contract is the mission-critical next step for successful transdisciplinary professionalism. Do you agree, strongly agree, neither agree nor disagree, disagree, or strongly disagree? We know that some of you will neither agree nor disagree, perhaps. It depends, right? Get off the fence. And I think in this sense, the social contract meant the full two-way sets of negotiations, not how some people have reacted to it here in terms of interpreting it as a kind of a one-way street that you go in with and give to somebody. Ah, what happened? The wrong labels on it, Hunter. Okay. Okay. Okay, so the labels are wrong, but we kind of know 1 to 5, right? And 5, and 1 starts with a strongly agree. Okay. Very interesting. Next question? Or anybody want to say anything about that? Hmm? Okay, next question. Last question.
Well, I mean, I just had a fun little side conversation with Mary Jo while you were voting, and she said, I would disagree. And I said, speak up, say why. And she said, well, it's harder, it's more cumbersome, it's not necessarily the next step, right? I mean, I don't want to speak for you, but, right?
Yeah, that
That's
is
a
what
good
I said.
point.
I said I thought the social contract was a really challenging place to begin, and sometimes deeper understanding emerges in understanding of both values and roles when you start to work together.
They can't hear you.
And then from that, a social contract could emerge.
Yeah, starting with the building blocks of a social contract and then building to the greater conceptual level of it.
And I
right?
think it's sort of like, I agree with her that it's more cumbersome, that it's more difficult, but I think you run the risk like we did in the civil rights movement and in other movements that you go charging off, thinking you know where it is you need to go, and about 2/3 of the way down, you finally say, oh, wait, the patients. And then you run back and get them, and they say, yeah, you actually need to go over here, so I don't know why you've spent so much time going that way. So I think ultimately it's a time saver, but it's definitely a time investor up front.
All right, very good, important point. Yeah, and I've been struck here by how people use the word society differently. If you use the word society, and Fred warned us about this in his talk, what is society? Some people feel like you're not talking about patients. Well, where's the patient in society? And if you use the word patients, then some people feel like, well, we want to talk about persons because we want to talk about health, not just health care. And so we have our language, our set of shared terminologies that we still have to work out among all of us. Yes.
There's a bunch of stuff written about this, but I think I mentioned this the last forum. Ben Crabtree's written a lot about one of the really important things about transdisciplinarity is developing language, which does involve figuring out. I was fascinated with that question about responsible. Who's responsible? Well, I think people were probably, I thought of that question as a lawyer. I can tell you who would get sued, but that is in some sense who's responsible. But then there are other people out there clearly thinking sort of more kind of moral and ethical things. And so I think that word is a loaded word as well. And we don't even know it's loaded.
Wow. And as we said yesterday, we're not even maybe at the interdisciplinary or interprofessional level yet, talking about the transdisciplinary, in which there is a new language, new models, new concepts, is where we're challenging us to even think about. Next question, and then I want to ask you some specific things for the.
Can I ask a question about this question? I think there's a word missing, and it would make a big difference. Students in health professions education programs should participate or do participate? Should participate, okay.
All right. Students in health professions education programs should participate in interprofessional courses that focus on health, well-being, and self-care of caregivers, as well as patients, as part of their required curriculum. We're going to start with strongly agree, to agree, neutral, disagree, strongly disagree.
I don't think you should change it. I think that the question is, what are you doing now? I think everybody probably agrees.
Actually, the intention was should. Yeah, that was the intention of the question.
Whatever the group intended is what it is. But you're asking another question, which is not an unimportant question. Yes. Yeah. Yeah. Okay. Should. All right. We only have 1 disagree, 2 neutral, right? 81% say agree. Okay. Very good. Anybody want to make a comment? How about somebody who disagrees? Not that there's very many of you, but would you like to say why? Not disagree, but I have a comment. Okay, a comment.
So one comment I'd like to add to it is that in our discussion group, we realized that this would be not too challenging a way to begin to bring our students together and then potentially also faculty and administration all the way from the very early years and thread it throughout their program to actually embed some of the values of health and well-being and disease prevention.
Actually, Liza, if I might add one other comment, is that it's actually almost like a triple strategy in a way, because it not only focuses on the caregiver, but teaching the caregivers skills that they can then use with patients to be advancing health and well-being, as well as then bringing them together for role development.
Mm-hmm.
Sorry, one last comment. There's actually very little education. I think we would all agree there's ultimately very little education in these areas that has any depth. At this point, it's really more rhetoric oriented.
Thank you. I would now, Fred, did you want to say one more comment, and then I'm going to invite Matt up.
I was a yellow.
Yellow, okay.
In part because I was filled with equivocation over the notion of, although we have a concept that we talk about quite readily on unnecessary care, I don't know that we have a way of talking about unnecessary education. And as we come up with new things for our students to do, which may be wonderful, there's something else that's got to go. And I don't know if educators deal well with that.
No. I know the answer to that one. Okay, Matt, would you please come up? Because we have a series of questions that we would like to ask you to kind of follow up with this.